Crohn's disease is a type of inflammatory bowel disease, IBD, in which an abnormal immune system response causes chronic inflammation in the digestive tract. This can lead to abdominal pain, severe diarrhea, fatigue, cramping, weight loss, malnutrition. Crohn's is often confused with ulcerative colitis, which is another IBD or inflammatory bowel disease that only affects large intestine. Who can get the Crohn's disease? Anyone can develop Crohn's disease or ulcerative colitis. IBD, however, are usually diagnosed in young adults between the age of 15 and 35. Children are twice as likely to be diagnosed with Crohn's disease as ulcerative colitis. Boys develop IBD at a slightly higher rate than girls. Risk factors for Crohn's disease are not clearly established, but family history and cigarette smoking could be the factor in the development of that disease. Causes. One famous cause of Crohn's disease may be an autoimmune reaction where the immune system mistakenly attacks healthy bacteria in the GI tract. Crohn's most commonly affects the end of the small bowel, the ileum, and the beginning of the colon. That said, it may also affect any part of the GIT tract from the mouth to the anus. Approximately 20% of people with IBD have another family member with IBD, so there is a genetic factor, and families frequently share a similar pattern of the disease. There may also be an environmental element. Rates of Crohn's are higher in developed countries. Urban areas and northern climate are more affected. Stress and diet may worsen the Crohn's, but neither is thought to cause the disease. It's likely that Crohn's is caused by a combination of the factors. Symptoms: diarrhea, abdominal pain and cramping, blood in the stool, mouth sores, reduced appetite and weight loss, pain, fistula may happen. Other general symptoms include fatigue, fever at night, and sweats. Most people with Crohn's have episodes of disease activity followed by remissions. The stress of a flare-up can lead to anxiety and social withdrawal. Diagnosis and treatment. There is no single test that can positively diagnose it. Diagnostic testing may include blood tests to look for infection or anemia, fecal test to see if there is blood in your stool, endoscopy or colonoscopy to get a good look and take a sample biopsy. Imaging tests such as CT, MRI. What about the treatment of the Crohn's disease? Actually, there is no cure for Crohn's disease. The treatment usually involves a combination of approaches. The goal of medical treatment is to reduce the inflammation that trigger your signs and symptoms. So they will use immune suppressants that can help control your immune system inflammatory response. Dietary modifications, especially during severe flare-ups, can help reduce disease symptoms and replace lost nutrients, such as avoiding carbonated drinks, avoid popcorn, avoid vegetable skins, nuts, and other high-fiber foods. Drinking more liquids, eating smaller meals more often, and keeping the food diary to help identify the food that caused the problem most to you. Complications. There are lots of complications happening with the Crohn's, like cardiovascular disease, respiratory disease, cancer, arthritis, kidney disease, liver disease, and it can lead to fissures or intestinal perforation, bleedings, malnutrition, anxiety and depression, many complications coming with this Crohn's disease. For Crohn's disease, prevention and treatment, we do recommend these types of probiotics. The first one is the Gut Plus, because the type of the bacteria, the Lactobacillus rotary DSM 17648, it has the ability to eradicate the bad bacteria, mainly the H. pylori, and by that will increase the population of the good bacteria and reduce the population of the bad. And also we do recommend this one, the Immune Breathe Plus, because this one has the ability to balance the immune system and bring it to the normal state. And by that, they will get a lot of benefit by increasing the population of the good bacteria of the Lactobacillus sakei probio 65 and balance the immune system.